for you. And at 8:44, let's check in with Elisa Becerra.
Yeah, we're joined now by Dr. Ben Shadle. He's from the Sacramento Bariatric Metabolic Institute. And we're talking about surgery as a cure for diabetes. And we were talking about there's a little controversy because we've heard for so many years what you really need is to exercise and eat well and try to avoid surgery. And maybe not so much is what you're saying.
Correct. Yeah. And by all means, we're not saying that you do not need to exercise, you do not need to eat well. But the polls in society are so strong about to create obesity and diabetes that what we're finding is that the only thing that we've found so far for long-term cure of diabetes and obesity are these procedures that we do.
Yeah, because basically what you're saying is people just, even though they've heard it, they're not exercising and eating well, and they're running into problems with diabetes.
Right.
So we've heard of gastric bypass surgery. So tell us about that and tell us about a different procedure.
So the gastric bypass procedure is something that's been done for 40 years, but has become much more popular in the last 10 years as we've been able to perform these surgeries laparoscopically, meaning just tiny incisions almost becoming an outpatient procedure. So the way this surgery works is that it changes the way that our brain talks to our stomach and the rest of our gut, and it talks to the pancreas. So when people wake up from surgery, they're not hungry like they used to be, and the diabetes, even before you lose the weight, is generally cured. Most of our patients go home on no medications the next day.
That's pretty incredible. Okay, you have a visual here of what the gastric bypass one, that's this one over here, Tavar. And tell us what the actual process is. What happens to the body when you do the surgery?
Yeah, so with the gastric bypass, basically you're just bypassing the stomach. So we make, out of the stomach, we make a very small pouch. The food comes down, goes into this small pouch, and then immediately into the intestine. So what that does is it sets up a feedback loop to the pancreas and to the brain, telling us that you must be full if this food's getting there immediately. So the stomach stays in there, it still produces all the digestive juices, and they dump in a little bit downstream to absorb the food normally.
So you're just kind of skipping part of the body. Okay, this is the sleeve, and you said this is a different procedure. Tell us what happens here.
Yeah, well, this is actually still the gastric bypass, but again, showing the food going down.
So yeah, let's go over to the sleeve, because I thought this was really interesting. So what happens here?
The sleeve is actually a newer operation. We've only been doing this for about 5 years. It's gained much popularity. The reason people like this, there's a little lower complication rate. What you do is you make the stomach, instead of this big sack for holding food, you make it into a small sleeve. So, and you remove this part of the stomach. What that does is it changes the hormones again in the body, feeds back on the pancreas to cure the diabetes, and patients just aren't hungry after this surgery.
Now the differences between the two, because we know about the gastric bypass, that is reversible, the sleeve is not.
Correct. That is one of the drawbacks of the sleeves, that you can't put the stomach back in after you've taken it out. But
it's very effective.
Correct. It's almost as effective as a gastric bypass.
Now, I thought it was really interesting too. This is done by small incisions. That piece of the stomach, you don't cut into the body and take it out and open it up. You actually pull it through one of those small incisions.
Through about a 12-millimeter incision. So.
Teeny.
Correct.
Yeah. And that is probably a little safer for patients who are having to go through this.
The recovery time is much quicker. We do all our surgeries, everything we look at is magnified under the camera, so we think it's actually safer to do the surgeries laparoscopically.
Absolutely.
Than opening people up.
How long is the recovery time from something like that?
Generally,
yeah, here we're showing you, these are the small incisions.
Correct. We
this
put
is how you
these
go in?
Instruments through the abdominal wall, these little tiny incisions, put a camera inside the belly to look around and to do our work in there. So generally the recovery time is very quick. People are home from the hospital in about 2 days on average, and then back to work within 2 or 3 weeks.
And basically what this does, again, just to clarify, is it tells the body you're not so hungry.
Correct.
And people should still eat right and exercise.
Yeah.
Wow.
Obviously.
All right, well, wonderful. Thank you so much for joining us.
And
if you have any interest on this, we'll definitely post this to our Go button on our website, and you can check it all out there. Paul, Bethany?
Thank you, Elisa.
I got to jump in. Just one real quick question. We're talking about providing great help for type 2 diabetes. When we talk about a cure, we're talking about type 2 and not type 1, correct?
Correct. Okay. Type 1 diabetes is an autoimmune disease.
Right.
So the problem is the pancreas is not producing.
We've just been generically saying diabetes, and I wanted to be very clear on that. Okay, thank you very much, Doctor.
Well, for the first time in 13 years, there will soon be a new diet pill available to help some overweight people fight the battle against obesity.
Yeah, the U.S. Food and Drug Administration.